And Bronson's 4 hospitals in Michigan are nearing capacity, caring for the influx of COVID patients, but they aren't necessarily in full-on panic mode, and they don't want people getting the wrong idea. Doug has more from this from our video wall and a closer look at those numbers. Doug.
Yeah, let's start, Annie, with Kalamazoo's numbers. So today, 167 new cases. And keep in mind, of course, Kalamazoo is where Bronson Methodist is. That's what we're talking about in this story. But if we look at the averages, that's where things start to get a little interesting. And we'll do it by population. So the 7-day average per 100,000 people. In Kalamazoo, I mean, they're right on par with a lot of places around them. So Grand Rapids, even Ottawa County, which has both Grand Haven and Holland, even Genesee County, if I can find it here, where, of course, Flint is, that's dead even with Kalamazoo, and, of course, Battle Creek, which was just listed as one of the worst-ranked metro areas in the country in the New York Times for cases, is also right on par with Kalamazoo. And it's kind of disturbing for people who are in healthcare, but those at Bronson today told me that they are far better equipped to handle this now, later in the pandemic.
Bronson exists to care for this community through thick or thin.
And Bronson Health's Chief Clinical Officer, Dr. Martinson Arnon, says, yes, things are bad right now, but despite their hospitals nearing capacity, things aren't so dire that they can't still do their jobs.
We are not necessarily staying at a level of capacity that would prevent us from being able to provide care.
This week, all 4 of Bronson's hospitals hit 99% capacity, meaning regional transfers were stopped and ambulance traffic was diverted. But having learned a lot in the year of COVID, they still want you to walk in for care if you need it.
We can actually do both things well. We've created protocols to allow us to safely care for non-COVID patients as well as COVID patients.
Plus, staff is vaccinated and they have more testing and more PPE. Bronson's system hit their highest capacity on November 11th with 105 COVID patients checked in. As of Thursday, they had far less, 74 COVID patients taking up beds. It's nowhere close to the low of 15 patients on February 8th, but Dr. Arnon says almost none of the hospitalized patients were fully vaccinated, meaning those shots are working. And Dr. Arnon says it's our best chance at bringing down the numbers for good.
Get vaccinated, wear our masks, practice safe distancing, because that's the only way to give our frontline staff a chance.
And so the good news, Annie, is that Kalamazoo County is actually doing pretty well with vaccines. 37% based on their population have received their first dose, 23% their second dose, and that is right on par with places like Grand Rapids, almost dead even with Kent County, which of course is much larger by population than Kalamazoo is, and also Ottawa County, again, where we find Grand Haven and we find Holland, and it's doing far better than Muskegon at just 32%. So the good news for Kalamazoo, Annie, is their vaccination efforts are actually going pretty well, and as Dr. Arnon said, he thinks that is the biggest factor in getting these hospitalization numbers down.